Myocardial infarction. A myocardial infarction, commonly known as a heart attack, is a life-threatening condition that occurs when blood flow decreases or stops to the coronary artery of the heart, causing tissue damage to the heart muscle. This is usually the result of a blockage in one or more of the coronary arteries. Due to this blockage, the heart can't get the oxygen it needs. A blockage can develop due to a buildup of plaque, a substance mostly made up of fat, cholesterol, and cellular waste products, or due to sudden blood clot that forms on the blockage. Myocardial infarction is the end result of either acute or chronic myocardial ischemia. Symptoms of a heart attack can be different from person to person or from one heart attack to another. Some people have mild symptoms, others have severe symptoms, and some people have no symptoms. Common heart attack symptoms include chest pain that may feel like pressure, tightness, pain, squeezing or aching, heaviness or pain, and discomfort in your arm or below your breastbone. Pain or discomfort that spreads to the shoulder, arm, back, throat, neck, jaw, teeth, or sometimes the upper belly. Fullness, indigestion, or choking feeling. It may feel like heartburn, nausea, cold sweating, upset stomach, vomiting. Lightheadedness or sudden dizziness, shortness of breath, severe weakness, anxiety, or unusual fatigue, fast or uneven heartbeat, discomfort in your gut. It may feel like indigestion. Women may have atypical symptoms such as brief or sharp pain felt in the neck, arm, or back. Sometimes the first symptom sign of a heart attack is a sudden cardiac arrest. Some heart attacks strike suddenly, but many people have warning signs and symptoms hours, days, or weeks in advance. Chest pain or pressure, angina that keeps happening and doesn't go away with rest may be an early warning sign. Angina is caused by a temporary decrease in blood flow to the heart. How common are heart attacks? According to a research, about 1 in 7 deaths in the US is due to coronary heart diseases, which include heart attacks. Therefore, heart disease is the number one cause of death in the United States. What happens during a heart attack? When a heart attack happens, blood flow to a part of your heart stops or is far below normal, which causes that part of your heart muscle to die. When a part of your heart can't pump because it is dying from lack of blood flow, it can disrupt the pumping sequence for the entire heart. That reduces or even stops blood flow to the rest of your body, which can be deadly if it isn't corrected. There are major and minor heart attacks. Major heart attacks usually occur when a sudden clot develops in a vessel that is partially obstructed. The blood flow in that vessel closed. The muscle fed by that vessel then begins to die, which causes major heart muscle damage. That muscle damage causes pain, though some have silent heart attacks with no pain as muscle dies and turns into scar tissue. When you have a heart attack, you are prone to rhythm disturbances. A person can die as a result of a heart rhythm gone haywire. The heart doesn't necessarily stop with every heart attack, but it can. Minor heart attacks occur when vessels with critical chronic obstruction are placed under certain circumstances where the muscle is demanding more blood flow than it can receive. This also results in muscle damage. A minor heart attack is not necessarily life-threatening. Lifestyle changes can reduce all of the modifiable risk factors for the heart disease, heart attack, and stroke. First of all, you should stop smoking. If you or someone in your household smokes, encourage to quit. We know it's tough. If you commit to quit, it will help you and your loved ones to prevent from chronic heart disease. Choose good nutrition. A healthy diet is one of the best weapons you have to fight cardiovascular disease. The food you eat and the amount can affect other controllable risk factors, cholesterol, blood pressure, diabetes, and overweight, etc. Choose nutrient-rich foods which have vitamins, minerals, fibers, and other nutrients but are low in calories over nutrient-poor foods. Reduce blood cholesterol level. Fat lodged in your arteries could trigger a heart attack or stroke. You have got to reduce your intake of saturated fat, trans fat, and cholesterol and get moving. Lower high blood pressure. High blood pressure is a major risk factor for stroke and ultimately heart attack. Reduce intake of salt because it can lead towards high blood pressure. An optimal blood pressure reading is less than 120 per 80 mm mercury. Maintain a healthy weight. Good nutrition, less calories intake, and physical activity are the only way to maintain a healthy weight. Obesity places you at risk for high cholesterol, high blood pressure, and type 2 diabetes, and these factors can increase the risk of cardiovascular diseases. Reduce stress. Stress in person's life can increase the risk of coronary heart disease. Stress can cause increase in blood pressure due to which heart attack may occur. Limit alcohol. Drinking too much alcohol can raise blood pressure, increase cardiomyopathy, stroke, cancer, and other diseases. Now comes to the treatment of the myocardial infarction. Take nitroglycerin if prescribed to you by a healthcare provider. Take it as instructed while awaiting emergency help. Take aspirin if recommended. Taking aspirin during a heart attack may reduce heart damage by preventing blood clotting. Other treatment of heart attack includes angioplasty, cardiomyoplasty, atherectomy, stent procedure, bypass surgery, and heart transplant. If you like my video, please like and subscribe to my channel.